Welcome. In this video, you will learn about how to protect your loved ones from infections that sometimes happen at the hospital. There are some simple but important things you can do when visiting loved ones. You can improve your loved one's care by taking an active role. Wash your hands before you enter your loved one's room and as you leave. Make sure that all doctors, nurses, and other healthcare providers wash their hands before and after caring for your loved one. If you do not see them doing so, ask them. Let's look at some video clips to learn more. In this first clip, Kelly is visiting her father. She asks the nurse about hand washing because she's not sure if she understands it.
Hello, Mr. McTavish.
Hey, please call me Tom.
Okay, well, Tom, it's nice to meet you. My name is Sarah, and you must be his daughter.
Hi, my name's Kelly.
Oh, it's nice to meet you. And will you please forgive me if I don't shake your hand? I just washed mine, so we want to be extra careful.
Oh, I'm sorry, of course. So there's something I'm curious about.
Yeah?
The hand washing procedure. I guess I'm just not sure how often people should do it.
Everyone that comes in this room, nurse, doctor, visitor, whoever, should wash their hands when they come in and when they go out. It prevents germs from coming in or going out. If you ever see anyone that comes in without washing their hands, you should speak up and ask them to, okay?
Does the hand sanitizer count? I wasn't sure if I should use that stuff or do it the good old-fashioned way.
Well, either. I mean, you'll want to wash your hands with soap and water if they're visibly soiled or have something on them. But just for killing germs, the hand sanitizer works great. Some studies even show that the sanitizer is more effective. All of this hand hygiene stuff goes for you too, Tom. You'll want to wash your hands as much as possible and avoid touching your bandage.
You're no fun.
Everyone who enters your loved one's room should wash their hands when they come in and again when they leave. You should wash your hands often, especially after touching things in the hospital room, before eating, and after using the restroom. You can wash your hands with soap and water, but using an alcohol-based hand rub can also be an effective way to prevent most, but not all, infections. Check with your loved one's healthcare team if you're not sure about what method to use. Let's watch Kelly speaking up and asking a doctor to wash her hands.
Oh, hello, sunshine.
Just gonna check your dressing.
I don't mean to interrupt, but could you wash your hands? Sorry, I don't even know if you need to because you're wearing gloves, but the other nurse said that everyone should wash them whenever they come in the room to prevent bringing germs in. So if you could please, I'd really appreciate if you could wash your hands.
Fine. I'm sorry. If I was in your shoes, I'd say the same thing.
Healthcare workers can be busy, but it's important to have open, respectful communication with your loved one's doctors, nurses, and other healthcare providers. If you don't see healthcare providers wash their hands, or if something doesn't make sense, speak up and ask questions. When your loved one is being discharged from the hospital, ask your doctor to explain the treatment plan that your loved one will follow at home. Let's watch one more clip of Kelly and her dad. Sometimes you have to speak up to keep your loved one safe.
You'll be out of here soon enough, Dad. Did you remind Bill and James to wash their hands when they came in?
Oh, yes, ma'am. Yes, ma'am.
Told them if they didn't, the boss lady would have their hides. That put the fear in them.
We're just trying to be as careful as we can.
Yeah, this baby's healing up real nice. Still looks a little gross, though.
Dad?
What? I just want to check it to make sure it's healing proper.
Dad, please, I'm serious. The nurse gave you those instructions for a reason.
Hey, man, it's the doctor's orders.
Listen, you can show off your battle scar when you're all healed up and get out of here.
I ain't got nothing on my shark bite. Look, Kelly, I was out in the North Pacific, and this huge...
Don't listen to a word he says.
Look at that.
Kelly made a good choice. Sometimes you might hesitate to speak up, but it's important to help keep your loved one safe and encourage him or her to listen to the doctors, nurses, and other healthcare providers and follow instructions. If your loved one is given antibiotics, encourage him or her to take the medicine as prescribed. So remember, like Kelly, family members and visitors have an important role in infection prevention. You are an important part of the healthcare team. When visiting your loved one in the hospital, wash your hands often before and after entering patient rooms. Also, speak up and ask questions of your loved one's doctors, nurses, and other healthcare providers. Encourage your loved one to follow his or her treatment plan. It can help keep your loved one safe.